Hi guys, I'm Bryant Greening with LegalRideshare. We've been hearing from drivers every day who are concerned about how the coronavirus is going to affect their health, their ability to work, and their livelihood. With all the anxiety and unfortunately the misinformation that's out there, we thought it would be helpful to bring in an expert. Dr. Eric Mizuno of Weiss Hospital is with us today. Dr. Mizuno is also the medical director at the Admiral at the Lake, the preeminent retirement home in Chicago. Dr. Mizuno, thanks for joining us today.
Thank you, Brian, for having me.
So we wanted to talk about coronavirus and how it's affecting the world at large, and in particular, some of the members of the gig economy. If you can, what is the coronavirus?
So as we all know, it's all over the news. It's a respiratory virus. So it goes into your body through the holes in your head. You got 2 holes in your nose, 1 in your mouth. That's how we breathe in air. And in that air might be this virus. It could be a flu virus, a cold virus, a coronavirus, and it gets into our body. If it settles up here, you just have a sore throat or maybe a nasal thing called the common cold. No big deal. If it drops down deeper and deeper and deeper, it gets into our lungs, and that's how air gets into our body, which you cannot live without, so then it becomes life-threatening. Unfortunately, the current coronavirus does find its home deeper into the respiratory tract and impairs our breathing, and that's a problem.
So what are some of the symptoms to look for if you've been infected or might have been infected?
So any infection, the first reason we think about it is I have a fever. So they have a cutoff of 100.4. These are definitions that they're changing in time, but it's that it has dropped lower. It's not just you have a runny nose, you can't breathe, you have shortness of breath or cough.
Okay, so we work with a lot of rideshare drivers, Uber and Lyft, people who are in close quarters with strangers. What are some of the recommendations that you would give for them in their work and to try to avoid this sort of infection or avoid spreading it around the community?
So the difficulty is, is there screening? Because you can't get something unless you get exposed to it. So if this person, they don't have cooties, they don't have a cough, or they're not short of breath, then as far as I can tell, without fancy testing apparatus in our vehicles, you can just tell, like, maybe you have it, that you don't have a fever, you're not coughing, you're not short of breath. That's maybe a screening that you might ask your passenger, and then it's onto the company and you to decide, are you going to take this passenger and maybe be infected with it. The second thing is there some barrier? And I'm going to say some things that are not necessarily popular or currently recommended, because we have to look at this on a population scale. If you have a mask on, then even though they're breathing, which is basically spitting on you, you're not going to breathe it in because there's a barrier. So, it may not be wise for population reasons because we don't have enough masks to go around, so you're taking it away from somebody else, but an individual might protect themselves with a mask perhaps. But the main thing is you screen them, and hopefully Uber and Lyft will find out a protocol where before the rideshare is accepted, they've screened the passenger for the driver and not put that driver at unnecessary risk.
So, Doctor, before we started today, you were describing the gold standard, what you would want to happen if you were in charge. What would that be? How would we be handling this right now?
Sure. Well, I'd love to be in charge. So the way to shut this down, because Italy and China, as their little test tubes have shown us, and for me as a medical director of a medical retirement community, tells us that in Italy it's skyrocketing, and in China it's skyrocketing. So the best thing is, if you're an infected person, you're not around anybody who you might infect. And so this is not to be around. This is why you're seeing the NBA make very wise decisions, MLB, unfortunately, March Madness, because if we're not around each other, we can just put this to rest. And if you're just in quarantine for, I think it needs to be at least a month, then it just dies off, because the virus needs a host that's a human being. And if I go long enough without skipping to somebody else, I just die off. And so I think a nationwide quarantine would be the best way.
So you mentioned the NBA, and I just saw that they have offered to pay all of the workers in the arena the time that they would have been working, even though they canceled the games. That's pretty generous of them. Uber and Lyft have not given that same benefit to drivers. They're saying, if you're diagnosed, we'll give you a couple weeks of paid time off. What do you think companies need to be doing to step up to ensure that these gig workers can take the time to heal that they may need?
Well, sure. I'm not a businessman, not at the level of either these rideshare companies or any big company, but the blood soul of a company are the workers. And as drivers, you make the money so that they can thrive and they continue to offer you a revenue stream. And so it would just make sense to me within the ability, if a driver is down income, and number one, we're telling people, do not be out in public. So what riders do you have? You have no riders if you don't have, you have no business if you don't have riders. So we're saying on the one hand, don't be out there. So you have no business this way, or you get sick, and like, well, please take yourself out of the game, because you're just gonna affect all these riders, and that's pretty selfish. And that's not gonna help this whole thing end more quickly, but how do you make income? You know, many drivers, you have this wonderful opportunity for an income because you need this revenue stream, and many people they're working from paycheck to paycheck. So for me to take a week off, well, maybe some people can, but well, hey, many people can't. So what are we gonna do in the meantime? I don't want to infect other people. I really don't. Nobody intentionally hurts other people. That's a very rare thing. But it doesn't matter, because if you're unintentionally hurting people, it's the same outcome. But you need to be shielded from this, and ideally companies step up, or the government steps up, and they give you the same revenue stream or similar, so that you can pay rent, you can buy groceries, you can take care of families. And so somehow that needs to be worked up on a much higher level, and that hopefully will come to fruition very quickly. This is spreading very quickly.
So you make a really interesting point about people who work in rideshare often can't afford to take time off just because they might feel sick or might, suspect that they could be infected with some sort of illness. What should drivers be doing in addition to maybe wearing a mask in the cars? How do you sanitize a car each time somebody gets in, or things of that nature?
Excellent question. So, I mean, drivers in the cars I've been are largely very clean. But that's the appearance. The problem is the virus is, it's pretty small. So small you might not be able to see it. It's so small you can't see it. And so the CDC has put out the number of disinfecting substances that perhaps the company can provide to you, although this is coming in short supply too, of what are you wiping down with to ensure that the virus is not going to be spread. Because how does the virus get in? It's either floating in the air and I just breathe it in, or I have this habit of putting my hand around my face, I get it into my fingers, I shake your hands, or I touch a doorknob. You have this horrible habit of touching the doorknob. Why? Because I need to turn the doorknob to get into the room. Now I have it on my hands, and I have that same crazy habit of putting my hand around my face, and it gets in that way. So any surface that is highly likely to be touched needs to be sterile to try to prevent that spread component.
Well, in a rideshare car, you've got the door handle, you've got the handle next to the outward door, you've got the seats. People are touching everything, trip after trip after trip. Does something as simple as Lysol help?
So once again, you have to look at the chemical content, and also not a chemist, but the CDC has put together a website of the things that would, as far as we know, would likely disinfect the virus out of your vehicle, along with everything else. There's the flu, which is still much more highly prevalent. It's not as life-threatening, but why would you want to catch anything? It gets you out of commission. And so the good news is that if you protect yourself against one thing, that one strategy will probably protect you against many things.
Right. So, Doctor, I want to end with this. A lot of people are hearing news stories saying, say, 80% of the infections are minimal. They're not requiring much medical treatment. The symptoms aren't that bad. Why do we need to be concerned about this?
All right, so there's two reasons, as far as they say. As everyone knows, the data is still being accumulated. So number one, we actually don't know that. That's some funny number. And I could say, well, in 250% of cases, which is more than the total people. These are just numbers that we don't know. The second thing is medical director of a retirement facility, and all of you have loved ones that are older. So it might be true if you're younger, yeah, you just get a cold and a little cough. What's the big deal? There is no big deal. Stop complaining. The thing is, you'll be around a loved one, I hope you are, and you're going to infect your 84-year-old grandmother and she's going to die. This is not something that's morally acceptable. So the main reason I think we need to go on nationwide shutdown and quarantine is for our loved ones. And if they get it, we'll treat it with antibiotics. We don't have an antibiotic. If you're following this story, there's over 20 people that died in a nursing home facility in Washington because they got it and we had no way to treat them, so they just died. And so I think we have to be all a little less selfish about the things we do, but knowing the situation a lot of drivers are in, you have to drive to make a living, and this is a twofold problem. You don't have as many riders, and that will increase once this is all over with. So you make a short-term sacrifice to have the all clear and all the riders are back in a normal working economy. We get back to normal functioning as quickly as possible.
So to put a bow on it, be safe for yourself, be safe for your loved ones, and be safe for the riders in your car who you don't know their medical conditions. You don't know how vulnerable they may be.
100%. And I did make that point. You don't know your rider. Maybe they're immunocompromised. And by the way, that rider, I believe they have a mother and a grandmother. They're in the same situation as you are and as I am. And so I'm trying to push the message out to just try to, as we say, distance ourselves. It's called social distancing, so we don't infect others. And it's not with intention. That's never the point. We're not the nefarious and paranoid about thinking that, but that's the truth because it's an invisible bullet that's certain to kill people.
Dr. Mizuno of Weiss Hospital, thank you so much for joining us.
Okay. Thank you, Brian, for having me.
Yes.